Two important factors for initiation of caries by oral streptococci are correct answer is synthesis of insoluble dextran and production of glycosyl transferase. Streptococcus mutans has been most consistently correlated with the development of dental caries. Glycosyl transferase polymerizes the glucose moiety from sucrose to form dextran. Dextran is a insoluble adherent substance which promotes the accumulation of bacteria on the tooth enamel. Which of the following viral associated enzymes is unique to RNA tumor virus? Correct answer is reverse transcriptase. RNA virus consists of merely a protein coat surrounding an RNA nucleic acid coat. These viruses are able to replicate and synthesize protein only by first generating DNA. This is accomplished with the use of reverse transcriptase, which synthesizes DNA from an RNA template. Anaerobic bacteria lacking catalase are generally motile, sensitive to hydrogen peroxide, insensitive to hydrogen peroxide, producer of water and oxygen from hydrogen peroxide. Correct option is sensitive to hydrogen peroxide. Catalase is present in all animal cells and all bacteria other than obligate anaerobes. These enzymes prevent the accumulation of hydrogen peroxide, which is toxic to cell and microorganism. Which of the following is characteristic of prokaryotic cell? Mitochondrion, nuclear membrane, single chromosome, endoplasmic reticulum. Correct option is single chromosome. Two fundamental cell type exist. Prokaryotic cell are very simple cell. The bacteria and the blue algae are essentially modified prokaryotic cells. These cells lack specialized organelles such as nucleus with its nuclear membrane, mitochondria and endoplasmic reticulum. DNA is found in cytoplasm. Multiple drug resistance is related most closely to virus, plasmid, transformation, cell chromosome. Correct option is plasmids. Plasmids are self-replicating autonomous segment of DNA located in the cytoplasm of many bacteria. These genes package code for proteins which has a variety of functions. Most relevant to protein care are the plasmids which confer drug resistance. These plasmids are referred to as R factor, where R stands for resistance. R factor encodes enzyme which inactivates various antibiotics. Which of the following is characterized by a cumulative antimicrobial effect? Iodine, alcohol, cationic detergent, chlorhexidine, gluconate. Correct option is chlorhexidine gluconate. Chlorhexidine is an antiseptic which kills gram-positive bacteria and other organisms by disrupting their plasma membranes. The different type of Streptococcus pneumoniae are distinguished by fermentation reactions, distinct H and O antigens, distinct somatic proteins, distinct capsular polysaccharides. Correct option is distinct capsular polysaccharides. Streptococcus pneumoniae are gram-positive diplococci which are encapsulated. The specific polysaccharides composing the capsule distinguish the various strains of pneumococci. Which of the following most accurately describe the antimicrobial mechanism of penicillin? Inhibits DNA synthesis, inhibits the terminal step in peptidoglycan synthesis, inhibits protein synthesis in growing bacterial cells, disrupts the integrity of the cell membrane. The correct option is inhibits the terminal step in peptidoglycan synthesis. Both gram-positive and gram-negative bacteria have cell wall composed of peptidoglycans, which encase their plasma membrane. Peptidoglycans are composed of polymers which are cross-linked to form a stable barrier in the terminal step of peptidoglycan synthesis. Common oral manifestation of Addison's disease: melanosis, xerostomia, glossodynia, loss of lamina dura. Correct option is melanosis. Addison's disease is term used for adrenal insufficiency of any etiology. consistently, the production of adrenocorticotropic hormone is increased. Linked to adrenocorticotropic hormone production is the production of melanoprotein, and this hormone causes pigmentation of the skin and the mucous membrane in the phenomenon known as melanosis. First human cancer that has been strongly linked to a virus is Hodgkin's disease, multiple myeloma, Burkitt's lymphoma, acute lymphocytic leukemia. Correct option is Burkitt's lymphoma. Burkitt's lymphoma is B-cell tumor which is the most common neoplasm in children in region of the world where Epstein-Barr virus is endemic. Osteomyelitis most commonly caused by Actinomyces bovis, Borrelia vincenti, Nocardia asteroides, Staphylococcus aureus. Correct option is Staphylococcus aureus. Osteomyelitis is an infection of bone which may or may not involve the bone marrow. It usually begins when a blood-borne organism, most commonly Staphylococcus aureus, is deposited in bone. Which of the following is elevated in the serum of patient with prostate cancer? Acid phosphatase, alpha fetoprotein, alkaline phosphatase, carcinoembryonic antigen. Correct option is acid phosphatase. Prostatic acid phosphatase, a type of acid phosphatase, is often elevated in the serum of patient with prostatic cancer. Immunocompressed patients are particularly prone to develop severe oral disease caused by Candida albicans, Actinomyces israeli, Streptococcus mutans, Streptococcus salivarius. Correct option is Candida albicans. Oral Candida albicans infection is a marker of immunosuppression. Tetany may result from hypofunction of which of the following glands? Thyroid, parathyroid, adrenal cortex, adrenal medulla. The correct option is parathyroid. Parathyroid hormone is an important hormone in calcium metabolism. Hypofunction of parathyroid gland leads to decreased serum calcium level. Hypocalcemia is associated with variety of symptoms including tetany. Which of the following is a significant effect of pheochromocytoma? Myxedema, acromegaly, hypertension, glycosuria. Correct option is hypertension. Pheochromocytoma is a tumor of chromaffin cells. Most of these tumors are located in the abdomen and 80% are found in the adrenal medulla. These neoplasms secrete catecholamines, especially norepinephrine, which cause paroxysmal hypertension. The indiscriminate use of broad-spectrum antibiotics is contraindicated because they frequently are extremely nephrotoxic, cause psychogenic symptoms, produce dependency reactions, interfere with indigenous biota. Correct option is interfere with indigenous biota. Broad-spectrum antibiotics should be used with extreme cautions. Their utilization leads to the eradication of normal flora, colonizing many sites throughout the body. A positive skin test in an individual who has had tuberculosis is an example of atopy, autoimmunity, hypersensitivity, passive immunity. Correct option is hypersensitivity. It is delay type hypersensitivity reaction mediated by T cells which recognize the tuberculin antigen and trigger an immune response at the injection site. Which of the following pneumoconiosis is most often associated with bronchogenic carcinoma with mesothelioma in man? Silicosis, asbestosis, anthracosis, berylliosis. Correct option is asbestosis. Asbestosis exposure has been linked to the development of mesothelioma and bronchogenic carcinoma. It is very rare disease, shows long latency period. Microcytic hypochromic anemia is most often due to infection, malabsorption, folate deficiency, chronic blood loss. Correct option is Chronic blood loss. Microcytic hypochromic anemia may be due to a variety of causes. The most common cause is iron deficiency, and iron deficiency may result from blood loss secondary to acute or chronic hemorrhage. As a result of dental prophylaxis, microorganisms around teeth enter the bloodstream. This condition is an example of anemia, bacteremia, septicemia, focal infection. Correct option is bacteremia. Bacteremia means bacteria in bloodstream. The bacteria can enter the bloodstream following dental procedures. Nephrolithiasis is most commonly to result from which of the following disease? Hyperpituitarism, Cushing disease, hyperparathyroidism, Paget's disease of bone. Correct option is hyperparathyroidism. Nephrolithiasis is term used for kidney stones. Kidney may be composed of a variety of constituents. Most stones are calcium containing, and most patients with calcium stone have elevated level of calcium. Serum calcium increased level most commonly seen in hyperparathyroidism. The ability of mammalian organs to regenerate after injury is best demonstrated by the liver, lungs, heart, brain. Correct option is liver. Liver cells are stable cells most adapted for replication. Patient is homozygous for a defective gene that substitutes valine for glutamic acid on the beta chain of globin. The most probable diagnosis is thalassemia major, thalassemia minor, sickle cell trait, sickle cell disease. Correct option is sickle cell disease. Sickle cell disease occurs when the red cells contain hemoglobin S instead of the normal hemoglobin A. Hemoglobin S molecules polymerize and aggregate when the hemoglobin desaturates. These polymers distort the structure of red cells, causing sickle cell-like shape. Removal of the capsule from an encapsulated bacterium is likely to result in loss of viability, decreased generation time, failure of cell to gram stain, increased susceptibility to phagocytosis. Correct option is increased susceptibility to phagocytosis. The capsule of encapsulated bacteria protects the organism from phagocytosis. Example is encapsulated pneumococcus strains are more virulent compared to non-capsulated pneumococcus, are easily destroyed, very low potential to cause any disease. 65-year-old man who experiences urinary retention or difficulty in widening his bladder most likely has carcinoma of the prostate, benign prostatic hyperplasia, malignant neoplasm involving the urethra, bladder metastasis of bronchogenic carcinoma. Correct option is benign prostatic hyperplasia. Benign prostatic hyperplasia is so common that it is considered normal consequences of aging. Half of the men over age 50 years have benign prostatic hyperplasia. Benign prostatic hyperplasia characterized by nodules in prostatic tissues, and when these nodules enlarge causes obstruction. The absence of cellular differentiation is characteristic of anaplasia, metaplasia, hyperplasia, hypertrophy. Correct option is anaplasia. Anaplastic tumors are usually more aggressive than tumors which show cellular differentiation. The most characteristic finding in intestinal malabsorption syndrome is pain, melena, anorexia, steatorrhea. Correct option is steatorrhea. Steatorrhea means fatty stool. Fat which is not absorbed get passed in the face. Most common cause is hepatitis, Crohn's disease, etc. Chronic passive congestion of lung is characterized by hyaline membrane, chronic bronchitis, thickening of alveolar walls, and hemosiderosis, giant cell arteritis. Correct option is thickening of alveolar walls and hemosiderosis. In chronic congestion of the lungs or left-sided heart failure, the patient is in a state of fluid overload, which leads to edema. The edema localized in the Interstitium surrounding the alveoli result in thickening of alveolar walls. A person with anti-A, anti-B isoglutinins in the serum belongs to blood group A, O, AB, B. Correct option is blood group O. Isoagglutinins are antibodies cause clumping of cells. These antibodies are only present in those individuals who lack the specific antigens with which the antibody reacts. Example, type A blood cells have A antigen on their surface and so O has no antigens. A cigarette smoking patient noticed a gradual onset of progressive labored breathing characterized by prolonged expiratory effort. The most likely diagnosis is bronchopneumonia, chronic bronchitis, pulmonary emphysema, carcinoma of the lung. Correct option is pulmonary emphysema. Emphysema is the disease of small airways that commonly afflicts heavy smokers after many years. In this disease, the elastic fiber in the respiratory bronchioles are destroyed and the lung becomes hyperinflated.